When I went to the hospital, I couldn't walk. My legs had stopped functioning.
My wife is receiving excellent treatment in the hospital. What happens when a patient is sent home?
The moment when I first greeted Mrs. Bilkees Latif, she was totally on bed. Although she was trying to move out of the bed because of his condition, post-surgery, because of the trauma, because of the pain, it was very heart-touching when we see patients like Mrs. Bilkees Latif who are very actively involved in for betterment of poor people.
When she went home, she was almost out of all the critical procedures, but she needed a lot of assistive support at home.
I think this has changed my life because it is one of the finest services that I could have thought of for somebody who's undergone serious surgery. Even before I came home, this home care service has been such a well thought out one that whatever had to be got, they told us about what we should purchase to bring home so that afterwards there's no delay. They came and arranged it all in the cupboards.
I still remember she was sent in an ambulance because she couldn't walk, she couldn't write. The physiotherapy was in full-fledged. She was about to get out of the bed, at least sit on a chair. But she was not able to use her right arm.
Every day, punctually, the nurses would come. And I was very touched when the night nurse decided that she would stay right through. And they were here day in, day out.
We train them and we select the nurses according to the skill levels and also according to the criteria what the patients are looking for.
So I would say they were all very dedicated and determined. And the manner I used to sit there when they were doing this, I was very touched.
At the end of the service, they were saying that even the nurses doesn't wanted to leave the patient and the patient also doesn't want to leave. Even after we discharge the patient, we still call them and find out, check on them and see how they are doing.
As she was actively involved in the social well-being of many people, many NGOs are working under her. She had one request that she had to sign. After exactly 10 days, I still remember that one, after 10 days, she called me up, she told me that she has done the signature of her first check. That was the moment when we thought that yes, we have done a very good job.
Even his arm had got all right. When I could lift this arm, I told the doctor, what's happened? I can lift my arm now. And then he said, how about your legs? I could lift my legs. I could then, when they got me to stand up, I could walk.
She should be as normal as before. She should continue her good work.
What a remarkable team there is at the Apollo Hospital. Wonderful. God bless you all.